Dr. Dart, thank you so much for making time for us today. I reached out and said we just wanted to kind of go over some viewer questions with you that we're getting through social media and email. But before we dive into that, I also wanted to ask if you could kind of touch on the Tulsa Health Department. It works independently from the state health department, but in conjunction. Can you kind of explain how that works?
Yes, in state statute, we're an independent, autonomous local health department. We're funded with a combination of ad valorem taxes and lots of other funding sources. So ad valorem makes up about half our budget, and all the rest of the funding sources make up the others. And we try and work in partnership with really all the local health departments in the state of Oklahoma and the state health department as well. I think we're a strong and integral part of the state public health system, and it's that state public health system that's really been responsible for our COVID response for almost a year now.
Well, I know you're very busy, so this brings me to my first question, because we've been getting viewer questions. I know some of these you've addressed before, some of them you have not, but I want to run through them. One of the questions we got is the only way to get your vaccine from the Tulsa Health Department through the state portal? Is there another option?
To the Tulsa Health Department, no, you've got to go to the state portal. Now, we do have some private providers who are receiving vaccine. They allocate it from us. We also have a couple of providers that are getting direct shipments, like our federally qualified health centers, OSU, but to receive it from us and THD, you need to go to the state portal. And then eventually, there's been about 253 providers in Tulsa County who have signed up to dispense vaccine. Once we have hopefully the available supplies, they'll start to receive direct shipments, and you can get it through private providers as well. And we're hopeful that day comes sooner than later, because we'd like many more access points than just THD and a few providers, so that we can dispense vaccine rapidly and get it out to as many people that want it and need it and will take it.
Now, I know we're talking a lot in news. I'm sure you guys are talking a lot about the different strains of virus or variants that we're seeing. And one person actually asked on social media, Diana, she said, how many different COVID vaccines can you or should you take for the different strains? So I think she's thinking maybe you have to get more than one, not just booster.
Right, and so far, we don't have different COVID vaccines for different strains. I mean, when this vaccine was produced, the variants, frankly, didn't exist, or we weren't aware that they were starting to circulate. And frankly, that's really the best reason to take this vaccine, because when the vaccine is transmitted and replicates, it has the potential to produce these mutations or variants. And the less people that we can get protected so that they're not being infected, the less potential for variants we'll have. So that's why it's important we focus on getting everybody vaccinated. There's just one, there's two brands, but there's one COVID vaccine, one from Moderna, one from Pfizer, covering the variant that we knew existed before the new ones became evident out in our community. So it's the one vaccine, two different companies. Of course, we all know that Johnson & Johnson is actually producing one as well. Neurovax is producing one really specific to those variants, but who knows when that's going to be available. So right now we have the two options to cover COVID-19, and that's what we're focused on.
Okay, and then we had another person ask, if I get vaccinated, can I still give someone the virus? It's still a little early, so we're still trying to find that data out. Many vaccines are created with either a live or inactive virus. Well, these vaccines aren't. They're created through a process using messenger RNA. And so you're actually taking the spike from the coronavirus, and it's fooling the body into creating antibodies to that, because that's the infectious piece. So we're not thinking that's going to be an issue, but it's still a little early, and that's information we'll have as this progresses. So my follow-up to that would be, if they get the vaccine, do they still need to wear a mask?
Absolutely, they do, and part of that is because this is so new, we still don't know how the virus and immunity is going to really act out in our natural environment. So once again, still a little early. So, and plus we know that without having 70–80% of our community immunized, we still have the possibility of natural transmission. Herd immunity will stop that natural transmission. So until we get to that point, even if you're vaccinated, you should wear a mask.
Okay, and then we had another question about, are you still only announcing openings on Facebook? Do they still, I think they're trying to ask, do they still need to follow the health department's Facebook page to know? Because like last night, you guys announced you had, I think, 500 more
opportunities?
Yes, I mean, Facebook is where we put our primary information. You know, we have, of course, like everyone else, we have different social media sites, you know, Twitter, but Facebook's where we post that information, and really, and that's where our portal link to the state vaccine portal is as well.
So that when they see that on Facebook, they need to go to the state portal to then try to.
Immediately, yes, get in and get an appointment. And I know it's, you know, I know people have been frustrated, but you know, we're tasked to give out our prime or our first doses within 7 days of receiving that vaccine, and we've given out 100% of our prime doses in that 7 days. So, you know, we're limited by the allocation that we get, and then, you know, this vaccine's for the entire state. So we've heard about Tulsans traveling other places to get vaccine. Well, we've also had people outside Tulsa County come to Tulsa County to get their vaccine, which also takes away spots from our Tulsa County residents. So that's the system we're in, and that's what we're trying to work through.
And there's not much that you can do about that at this point, it seems like, is what you're saying.
Exactly. There's really nothing we can do about that. That we're using the state portal, and people have options to go wherever they want, wherever they can find and open appointments. So, you know, we're not just serving Tulsa County residents here, and we've given, I think, over 10,000 vaccines to people from outside of Tulsa County, and we want everyone in Oklahoma to be vaccinated. But you know, we really want to get enough allotments so that we can vaccinate people here in Tulsa County so they don't have to travel.
Okay, and then another question, and this seems to be more about education, and this is from Derek. Are they going to do more education about how to properly wear a mask? So I think what he's referencing is that people are touching their mask and moving. And I think he's wanting to know if you're going to do more education about that.
You know, yes, we are, and we've created several awareness campaigns and educational campaigns. We're going to do actually another one in conjunction with both the vaccine and mask. And you know, we can't talk about the mask issue enough. I mean, because if there's one thing that I get concerned about, I see people wearing masks, but it just covers their mouth, and we know that potential for transmission through secretions from your nose is just as high as from your mouth. And so it's important to do this properly to ensure that you're safe and you're keeping others around you safe as well.
Now, I do have a question, because I'm hearing, are you guys, when someone comes to the Tulsa Health Department and they get their first vaccine shot, do you then automatically tell them when to come back for their second shot? Or is it like what we're seeing at other locations where they just say, hey, you need to get your second shot in this time frame? Or are you doing actual appointments?
We are. So what we do is that we basically schedule them for their second shot here, because we don't want anybody to go back to the portal. We know how frustrating going through the portal is just for that first dose. So what we tell people, depending on the vaccine that you get, if you get Pfizer, we'll ask you to come back in 21 days, bring your vaccination card, and come back about the same time that you were there for your first dose. If you got Moderna, come back in 28 days, come back to our clinic, bring your card, and again, come back about the same time you got your first dose, and we will get you your second dose.
So they do not have to go through the state portal if they're coming back to the Tulsa.
That's correct. Just come back with your card, come back, and on the back of your vaccine card, there'll be the date when you should come back. Come back on that date, and as I say, come back hopefully around the same time as you receive your first dose, and we were there, and we'll be waiting for you to give you that second dose.
Okay, and then I've had a couple of people ask me, and they're phrasing it in different ways, but basically it seems like what they're wanting to know is how long after they get that second, the second booster, the second shot, until they can feel like they're safe from COVID or safer from COVID.
You know, they should fully seroconvert to, depending on the vaccine, either 95% protection or 94.5% protection in 7 to 14 days. So it's really helpful. After that first dose, they're about 50%, and then that second dose will get them closer to that almost 100, not quite 100, but it takes 7 to 14 days for that seroconversion to happen and for the vaccine to produce antibodies.
And then one more question, and I have had people ask this, and sometimes there's a little bit less tact in this question, so I'm going to just try to ask it with no agenda. Have you seen a difference in getting vaccine or how the process is going since we've seen a shift in the administration at the White House?
You know, it's not so much we've seen a difference, but we're getting more information. We didn't get much information from our state provided the information they got, but we locally, especially, we weren't getting any information. And now I've been on several White House calls that they've held for state and local officials where we're learning more about their plans for future vaccine buildup and how they're going to allocate that second dose, how they're going to track it. And this information we never got before. So we are receiving more information that allows us hopefully to plan better and plan more appropriately to ensure that everyone gets their vaccine. But it's just really nice to know that these plans are in the works and we can guess less and plan more.
If you get vaccinated and you have not had COVID, and this is not a question from social media, this is just something I heard people discussing, and you may not be able to address it. Can you then go donate convalescent plasma, or are you out of that realm?
You're out of that realm, and you really want to be, antibodies are antibodies. Natural antibodies are, really are different than antibodies produced from vaccine, but they're still antibodies that protect you against COVID. But after one dose, you're still not producing enough antibodies to really have that full immunity, and you want that full immunity before you start donating for convalescent plasma.
And then if you've had COVID or you have COVID, how long do you need to wait to get your vaccine?
It all depends on when you had it, so we know that 90 days, we're pretty solid. The science is showing us that you pretty much have vaccine at least 90 days after that infection. Now, if you were infected a week ago, you want to make sure when you're infected, you're infectious for about 10 days. You want to make sure you're past that infectious period where you're no longer shedding virus, so you're not a danger to anyone else. And then anytime after that, it's let's get vaccinated. We'll get more antibodies going in you.
But do they have to have a negative test to get vaccinated?
No.
Okay.
And that's because it's really difficult to get that negative test, to be honest, because the protein that causes disease leaves a surface protein that sometimes can give you a false positive. So that's why we say we know that you do shed virus for about 10 days. We want to wait till after that 10 days so you're no longer shedding virus, because if we wait for a negative test, we might be waiting a couple months.
Now, you just said you've been on a call with the White House just before talking with me. Is there anything else that you want to say that maybe I don't know to ask just because of a conversation you just had or new information that you want to make sure people hear?
I think the word is getting out that vaccine is being produced at a rapid rate. Our country has purchased 200 million more doses. I think half of Pfizer, half of Moderna to be out at least by May. They plan to have 600 million out by this fall. So, we had concerns early on, but will we have enough? And we thought we did. Then we saw we didn't, and now feeling much better about we're going to have the resources and the vaccine we need to get it in everyone's arm that wants one and needs one, or actually two. So.
Yeah, wants one or needs two. Right. So basically, you just want to reassure people that you feel like now you'll be able to accomplish the goal.
Absolutely, and which I think is the important thing, because so many people have come to us, and I've been in our pods, and I've seen people really concerned about, will I have my second dose, and get very emotional both about getting the first dose, and then really show that concern about, am I going to get my second dose so I'll be protected? And we want to assure everyone that if you get your first dose here, we will get you your second dose.
Thank you so much for making time for this. I know you have a lot of things going on. We appreciate you. And this just allows us to get more information to our viewers, even if just through social media. So thank you, Dr. Dart.
You bet, Neile. You guys stay safe. Thank you for your time today. And I'm sure we'll talk again.
I hope so. All right. Thank you.
Bye-bye.